All right.
Awesome.
Welcome to the podcast, Brittany.
Thank you for having me.
So good to have you on. I met you through Vu, who was episode 3. And so excited to have gotten to get to know you and Julio through that friendship.
Oh my gosh, it has been such a ride, such a roller coaster, lots of fun. You guys are such a good group. So grateful to have met you and Kelly. And yeah, thank you for having me on the podcast.
Yeah, I'm so excited to just learn more about what you do and how you got there. And so why don't we dive right in? So
Mhm.
you work at is it called the Within Center?
Yes,
Okay,
the Within Center.
tell me more about the Within Center.
Yeah, so the Within Center is a ceremonial psychedelic clinic that's located downtown Austin, kind of like West Campus. It's unique because it's inside of a historical building, so it looks really homey and it's got good energy. But basically, we provide a treatment or a therapy for mental health disorders, so depression, anxiety, PTSD, trauma, substance abuse. And we use ketamine
Hmm.
as our psychedelic medicine, and we do it very ceremonially.
Okay. So what is ketamine?
Yeah, so ketamine was first brought in the 60s.
Hmm.
It's primarily an anesthesia medication, so it's used in surgeries and procedures, and that's how it was first used. And then it started coming about that ketamine was also helpful for mental health disorders.
Mm.
And so in the 90s, they started doing research, and now for the past like few decades, it's been increasing with being used with depression and anxiety and mental health disorders.
I see. So it sounds like it's a fairly new type of treatment, right? Or has it been around for a while?
It's been around for a while. It's still kind of like the Wild Old West.
Okay.
You'll see different clinics doing ketamine in similar but sometimes different ways. So, like for us, we're not very medical model at all. I think we're probably the only clinic in Austin, if not Texas, that does it the way that we do it. But still fairly new. A lot of research studies still coming out.
Hmm. So what is you're a nurse practitioner by trade, right?
Yeah, I'm a family nurse practitioner.
Okay. So did you always where did you start? Did you start off in mental health or did you recently make the transition towards mental health?
Yeah. So probably one of my biggest life lessons that I've had to learn is just kind of going with what excites you.
Hmm.
And when I started off nursing, I've always like told myself that mental health was difficult and I wouldn't do it. I'm not going to do that. And then I became a family nurse practitioner. I worked in primary care. Well, I started off in open heart surgery actually as a
Did you
nurse.
really?
Yeah.
Wow.
So I was in the OR, I was scrubbed in, I was helping the surgeon. And I was like, that's what I want to do. I'm going to become a nurse practitioner and I'm going to be in surgery. So, you know
Was
how
it
life goes.
Yeah, was it really intense for open heart surgeries? Like, is it like the shows where it's like pretty serious and
It can be,
okay.
yeah. It was a lot of fun.
Oh
I
wow.
really loved it. I thought that's what I was going to do.
What pushed you towards transitioning from that towards mental health?
Yeah, so I became a family nurse practitioner, and the first job that I got was in primary care. So, like your average Joe, primary care clinic where you go get a physical. And I quickly learned that if not most, like 70 to 80% of the people that come into primary care are going in for mental health disorders. So
Is
they're
it
going
really
in
that
for
high?
depression. Yes,
Oh
it's
wow.
pretty high. And a lot of people can't afford to go to a psychiatrist or pay for therapy. And so they try to go to their primary care doctor and get on meds, and their visits are short. And I felt like it was just a huge disservice to this population. And I wanted to dive into that more. And
Hmm.
so in primary practice is where I learned about ketamine. One of my clients came in, asked about it, and I was like, I'm going to learn about it. I prescribed him some like troches because they do make ketamine orally,
Mm.
and it was working for him. And so I decided to dive fully into ketamine and psychedelic therapy.
Oh wow. So it was yeah, it's interesting how like with like all the information that you can find online now,
Mhm.
how patients will often come in and provide, try to get your expertise on like, have you heard of this medication or your thoughts behind it? And then it kind of pushes you to also to have to like learn and like figure out, okay, like what is that drug? How does it work? But it's interesting how that sort of like physician patient relationship
Mhm.
isn't always like one way where it's like physicians, just telling or nurse practitioners telling a patient what they need, but how as a patient, you can be suggestive and like, hey, what do you think about this?
Yeah, exactly. And that's what I am really focused on now is it's not a hey, I'm the provider and you need to follow what I'm doing or saying. It's more of like a partnership. Like let's learn about each other and let's figure out what works best for you. The patients 100% have a say so in their care and the treatment that they get as well.
Yeah. Yeah, there's something to be said about like I have a cousin who's a nurse practitioner and she works for Mayo Clinic. And
Oh
we were
wow.
and we were talking about just like, how there's all this like pollen and allergy and cedar going on, and she was like, if I was licensed in Texas, I would prescribe you the antihistamine that you need. But she was like, talk to your like the online doctor. I did like the remote visit or whatever, and you have to like almost be suggestive, like, hey, like I heard about this drug, like, do you think it's fitting for me? Because sometimes, there's so much going on that a provider might not, think of a certain solution. And so I often think about like, how do you like I feel like a patient should almost prepare for a visit, right? And come up with, some suggestions and things and bounce ideas off of the provider.
Yeah, yeah, absolutely. There's so many different ways to treat something sometimes, and so being able to do your research and know what your options are.
hmm Yeah, so I want to loop back towards
Yeah.
ketamine now. So from a ketamine perspective, you said you started to like dive full in.
Mhm.
You said that it was like you saw some results and that it was working. What was diving full in like for you? Like, what did that mean?
Yeah, so going to a clinic that just provided ketamine therapy for mental health was my next step. And so now that I'm here at Within doing ketamine ceremonially, that's all I do. So all day long, I'm helping clients go through actual psychedelic ketamine
hmm
sessions, and I have a great team there at Within that helps me along the way. And it's just so fun to see clients come in and they're struggling and seeing how they progress and how they get better. It's like so rewarding to see how they improve.
Yeah. So what's the experience like? So
Hmm.
the I guess the initial part of like evaluating if this is right for me. Well, maybe we'll start there and then talk about and we'll just go through the whole experience.
Yeah, for sure. One really great thing about ketamine and why it's an essential medication is that it's very safe. And it's one of the only anesthetics that really doesn't cause respiratory depression, meaning like your breathing will go down,
Mhm.
doesn't really affect your heart rate or blood pressure or anything like that. So it's very, very safe. The first step is to make sure you don't have any medical conditions where you can't get ketamine, and those might include history of really severe like schizophrenia, psychosis, heart problems, stuff like that. And then once you're cleared, we dive right into hooking you up with your psychedelic guide. So,
Mm,
what's unique at our facility is you'll have someone sitting in the room actually holding space for you and guiding you throughout your ketamine experience. And these people are guides and have a lot of experience with psychedelic medicine.
mhm.
So, then you have your ketamine experience. It's an injection in your arm. It'll usually last about 45 minutes to an hour. And it could sometimes feel like a dreamlike state. And
Okay.
sometimes like very vivid dream or you're lucid dreaming. Maybe you're seeing things, color, shapes, memories. So you have your experience, and as you're coming back out, your guide will be there to kind of help you guide you your way out and talk about your experience and what you felt and saw and kind of put the pieces together on the messages you might have gotten
Mhm.
from it.
So it sounds like is this like a multi-week sort of program, or is it like do
Mhm.
you do one session, or how does that work?
Yeah, so if you're doing ketamine for the first time, especially with any psychedelic medicines, we do recommend doing more than one session because the first session, we're really just trying to figure out how you respond to ketamine and how your body reacts to it. And then from there, we can increase the dose based on your experience. And so most clients come in for 3 to 6 sessions. And throughout those sessions, we're assessing you and seeing how you're doing and putting you deeper into an experience if you need.
Yeah, yeah. Can you talk more about like the science behind ketamine and what's
Yeah.
happening during these sessions, like at a physiological, biological level?
Yeah, absolutely. So the full mechanism of action of how ketamine works isn't 100% understood, but there are some pathways that researchers have found, and one of them is ketamine is an antagonist to NMDA receptor. So downstream, it can kind of help with a neuroplasticity, so the growth of your neurons through something called BDNF or brain-derived neurotrophic factor.
Hmm.
I like to think of that as like the miracle grow of your brain cells.
I love that
So it'll
analogy.
increase that. Yeah. So a good analogy is when you've had many years of depression or anxiety, think of like a forest, like branches like shriveling up, not really flourishing. And then you put ketamine or really any psychedelic, it'll kind of flourish those branches and they start to grow and leaves start to grow as well. So it will increase those connections.
Hmm. That's fascinating how that works and just the evolvement of psychedelic medicine. I guess, like, is ketamine FDA approved for this or?
It is not FDA approved for mental health.
Okay.
So we are using it off label technically.
Okay. What does that mean?
So it's not FDA approved to treat mental health disorders. It's just FDA approved for anesthesia.
Okay.
But since it has other benefits, practitioners can use it. And that's part of the reason why it's really hard to get ketamine covered by insurance. So we are really working on that. We just need more research studies to be done and published with good data.
Yeah. From a like it's like psychedelic medicine, I assume isn't really like super mainstream yet, right?
It's getting there.
Is
It
it?
really
Okay.
is. Yeah, which is exciting.
Yeah. At what point do patients turn towards like looking and seeking for ketamine treatment versus more, I guess, traditional antidepressants? I guess how should people think about like, looking into ketamine treatment?
Yeah, that's such a great question. Most of my clients come in because they've already had many years of traditional treatment. That could look like trying like 3 to 5 to all SSRIs or psychiatric medications, therapy. And there's just something is not clicking. Either they're not getting to the root of the problem, they're still suffering, or the medications are causing too many side effects, or even just making them feel numb. And so they come in searching for that missing piece, or what else can they do for deeper healing?
Yeah, it's awesome that this is another potential solution where, if other treatment paths aren't working, maybe this is one that might work.
Yeah, for sure. And there's one FDA approved route of ketamine. It's called Spravato. It's a nasal spray. One of the requirements to get that is to have treatment-resistant depression, meaning you have tried 2 to 3 traditional psychiatric medications and have failed it. It is a really great option for when you've already tried all of those.
Yeah. And do patients typically, do they get referred to you or do they find you online and then they schedule time with you? How does that work?
Yeah, so most of our clients is word of mouth or they find us online.
Hmm.
We do get some clients where psychiatrists and therapists will send them over, but you don't technically need like a medical referral.
Hmm.
You can just come on in and sign up for a consult and see if it's a good fit for you.
Yeah. So from at the Within Center, you have clinical people. It sounds like you have guides as well. What other members and staff members do you have on your team?
Yeah, so we have a physician, he's our medical director. Myself, we have 2 nurse practitioners. We have psychedelic guides, therapists. We do have a psychiatrist, integration coaches. So
Okay.
one thing that we do too is after each session, you're paired with your own personal psychedelic coach to kind of help you really integrate and put the pieces together.
Got it. Okay. So I come in, you inject me. I have a 60 or so minute experience. What is the integration guide doing like at that time?
Yeah, so all of our guides bring in different tools. This is what I really love about where I work. They bring in different tools that they use throughout your experience. So they'll do aromatherapy, they'll have drums, they'll have singing bowls, they'll have chimes, and they really kind of lean into your energy and what you're doing to kind of help you move a lot of that and really support you. And so you'll have headphones and you'll have an eye mask on. The experience is 100% introspective. So, meaning we really want you to turn inwards and kind of have your experience. But they're there in case you need to cry or hold someone's hand or just talk through something that's coming up. They'll be there for you.
Yeah. And then what does the integration guide do after that?
So, the window of neuroplasticity is about 2 to 3 days after ketamine. And so, we encourage you meet with your coach in that time frame, and they'll meet with you and talk to you about your experience. And so based on what your intentions and your goals are, and what you're looking to change your process for the ketamine, they'll help tie that together with the experience that you're having.
I see. You're pretty much there with the patient at every step of the journey. Like you're there with them as they go through it. You're there with them afterwards, which I think is really just like, because I work in healthcare as well, just like on the healthcare tech side, and I used to work with health systems like St. David's here. But oftentimes the patient experience is, it's almost isolated, right? Like you see a provider, you may see a completely different provider the next time you come in. And especially with our generation, it's like we, at least I don't know as many people that have, a primary care physician. Like oftentimes people are moving or bouncing around or doing online visits, and you just kind of get whoever's there. But it sounds like the way that Within Center is set up, it's very thoughtful about, each step of the way.
Yeah, I love it. And we're really big on community. So when you come in, you're treated like family. And we also have like classes and workshops that our clients can come to and sit with other clients, maybe during like a group therapy or a group meditation circle or breath work, a cacao ceremony or sound healing. Like, so you don't just come and get the ketamine. You can come back in the evenings or on the weekends and hang out with the coaches and the clients and like help each other kind of heal.
Oh, wow. So it's like you don't just come for treatment, but you can come to spend time and do other like activities together as well.
Yeah.
Oh,
Yeah.
okay. That's awesome. Because I think oftentimes when I think about going into like a clinic, it always feels very like sterile, not the most warm place. You're there for that one interaction, then you leave. But it sounds like here you can really build, a foundation of like friendships there.
Yeah, exactly. And then that's the key, and that's what's important. We usually say that the actual ketamine medicine is like 20%, and it's really the work that you put in the community and the people that are helping you is like the rest of the healing.
Hmm.
Ketamine's a good catalyst, and then all of the other stuff is really where you can make those permanent changes.
Yeah. Yeah. Oh, that's fascinating. So what gets you excited about like ketamine treatment and like the work that you do? Like, what do you love about it?
The people that I work with and my clients. My quality of life has completely changed since doing this work.
Hmm.
And it's something that actually works. The way that we do it, I mean, clients are seeing amazing changes within themselves. Marriages are getting healed, relationships are improving between their friends and family members. And I just love coming to work and I just feel instant calm, like instant zen. There's like candles lit everywhere and the lights are nice and dim and everyone's just so happy and there's just love like everywhere. You can feel it as soon as you walk in.
Yeah. What a culture that the organization has. Is that I can just see you like radiating, speaking about the work that you do. So where do you see like ketamine and psychedelic treatment moving into the future? Like, is it evolving pretty quickly or what's going on?
Well, now Oregon and Colorado are legalizing psilocybin. MDMA is coming soon. So the way that our program is structured at Within, because it's very ceremonial, we're ready to pop in those medicines as soon as they become legal in Texas. And I know UT Austin is doing psilocybin research, and so we are in contact with them as well to hope that we can get in that too. But we're hoping to pop in MDMA for trauma and psilocybin medicines.
Wow. So it sounds like the types of medicine that, were historically, I guess, illegal are more and more being used as like serious, effective, or they're being looked at as like really effective treatment mechanisms for patients.
Yeah, absolutely. When you're using the right setting, when you're in the right environment, you go in with intention and you're with people that you connect with and trust, those medicines can be really profound in your deep healing.
Yeah. So did you always want to be a nurse practitioner growing up or?
Actually, no, it's so funny. And this is why I always say, things happen in your life for a reason.
Mhm.
It's almost like everything matters, but nothing matters at the same time. Um, just play the game of life and have fun, but also everything is falling into place for a purpose.
Mhm.
And so when I was going to college, I didn't really know what I wanted to be. I thought I wanted to be a veterinarian, and then I thought I wanted to be a marine biologist when I was a kid. I don't know why. I'm scared of the ocean. But then I didn't even know what college I wanted to go to, and my boyfriend at the time was going to UT, and I was like, I guess I'll go to UT too. And then my first few years at UT, I was a nutrition major.
Wow.
And I was like, God, I don't like this. I don't want to count every little calorie of this bowl of mashed potatoes. And so I decided to enroll in the nursing program. Like, hey, nursing is stable. It's, good work. It's rewarding. And I ended up getting in. It was a really hard program to get into. And I was like,
Yeah.
okay, I'm stuck with nursing. And then I ended up loving it. And then this is where I ended up now. So it's just so funny how things kind of just fell into place.
Yeah. I guess a lot of that, and I'm curious what your thought is, but for me, I think the older I got, the more I understood about like what motivated me and what I wanted. I think early on in life, I felt like, people give you ideas and like, you should be a doctor in my circumstance, right? Like you'll probably enjoy that and the job work is stable and everything. But as I get older, I realized like, oh yeah, I like healthcare, but I really enjoy business and like the logistics of it and the strategy and the operations behind it. I think it just took time for me to like understand myself better. I guess, do you feel like, was it because as you got older, you had a better understanding of who you are and what motivates you, or were there other factors that sort of helped you make the decision on nursing and becoming a nurse practitioner?
Yeah, 100% of what you just said. It took me a long time to figure out what I wanted to be when I grew up, like really like in the past 5 years. And that's okay. Like you don't have to follow this cookie cutter, like as soon as you go to high school, you got to go to college and you have to get a degree and you have to sometimes it takes some life experiences to figure out what your passion is and what you feel like your purpose is. For some people, you find your true self and your purpose quicker than others. And for me, it took me a while. I've had to learn some big life lessons. I had to go through some big life experiences. And now I finally see like I love what I'm doing now, and I am finally on that right path.
Yeah. Can you share more, or would you be willing to share more about a life lesson or something that maybe seemed like a failure, but maybe set you up for a later success and brought you to where you are today?
Yeah, so I would say a big life lesson is to not get in my own way.
Hmm.
So I always felt like I needed to follow something to make others happy, or to maybe make my parents proud, or maybe feeling like I was stuck in a path. And I'm actually back in school again. I'm getting my second master's degree in psychiatry to be a psychiatric nurse practitioner. And for a while, I was trying to talk myself out of it because, like, hey, I'm already a nurse practitioner. Like, why can't I just keep on that track? But really, you just have to follow what you want. Sometimes
Hmm.
you have to follow what you're passionate about. And it doesn't matter what anyone else thinks. It doesn't matter what you should be doing or where you should be at. Just, life, play the game of life and just have fun doing it. And sometimes you go on your own pace.
Yeah. So is there a way that you go about reflecting, or do you have a process for like being more introspective or like understanding who you are?
Yes. So, well, for one, psychedelic medicine has really, really changed my life. And then just making sure that I pause and kind of put self care first, which is really important for a lot of us in our busy lives. It's hard to do, but it can completely turn your life around if you just gave yourself some self care, meditation, and also the right people. You have to find your tribe,
Hmm.
people that lift you up, people that spark your energy and your passions. If you're in the wrong group, you're not going to be happy. So find your tribe, find yourself, and your life could be like great.
Yeah. Yeah. Finding your tribe, I think, is huge. And it's really hard too. And I think especially at, our age, where in college you're surrounded by people your age, right? Like it's pretty easy to meet new people, but
Mhm.
now I feel like it's like harder and harder. It's like, how do you meet people and build your tribe? Are there things that you've done to like that have helped you meet your tribe, or?
Yeah, so for me, it was my work. And
Mm.
so I followed what I was passionate about. I followed what I wanted to do. And it meant me leaving multiple jobs and people that I thought were my tribe. And that the place that I work, those people they're my tribe. Like we
Mm.
have share the same passions. We help others together. We do ceremonies and workshops and classes together. I mean, it's beautiful. And like my work and following what I love has brought me to my community.
Yeah, that makes a lot of sense because, like, for us too, it hasn't always been work, but for us, it's been maybe like a social activity or like a hobby. So we met a lot of our tribe through like a tennis league here. And I think it takes something that a shared like interest and a shared commonality, right? Whether that's a sport or the type of work that you do. But then I also think it's like repetition too, right? Like in the consistency that allows you to build relationships and get to know people deeper to where you start to like build a tribe.
Yeah, yeah, exactly. And like once you find your tribe, it just gets bigger and bigger because you start meeting their friends who are also similar interests. And like now I just have this big community like
Mm,
that I can go hang out with, and we have the same values and same passions, and we do yoga together and travel. So it's a lot of fun.
that's awesome. Yeah, I always like think like when I talk to friends about this, who are considering moving to a new city because, maybe they have outgrown the city that they're in or they're just ready for a change up.
Mhm.
And sometimes, they're nervous about meeting new people and there's this sense of like, oh, like to build community, I have to like, meet a bunch of people and then bring them together. But I guess I've always thought that like it really only takes one person, right? Like if you can meet one person that you really connect with, like that can domino into this person introducing you to this person, and then you end up go to an activity with another group of people, and all of a sudden like you're integrated into like someone else's group, and you can really start to make that your own and feel a part of that as well.
Yeah, exactly. I mean, that's how like Thomas and Vu and our group of friends happened. I
Mhm.
met Thomas at UT and we kind of just stayed in communication, and then now he led me to Vu, which led me to you, and now I'm on your podcast, which is
Yeah.
amazing. So exactly. That's a great example.
Yeah, no, that's yeah. That I mean, Vo's a super connector, so it's
He
funny
is.
because yeah, we met him and just it just kind of spidered out into like all kinds of different directions.
Hmm. So
So,
yeah.
um, once you said you were doing your master's in psychiatry and nurse practitioner psychiatry. Is that what it was?
Mhm.
Yeah. So, what does that allow you to do, and why did you decide that you needed to do that on top of your nurse practitioner degree?
Yeah. So with this concentration, I will be able to do psychotherapy, which is what I really want to do. And specifically with psychedelics, especially now that, we're using ketamine, MDMA is following psilocybin. I want to be able to actually do therapy with clients with these medicines. And I couldn't do that with my nurse practitioner. And
Got it.
also it gives me a better understanding of, the brain, neurobiology, and, psychiatric medications as well.
Yeah. So it's interesting, like um there's from a nursing perspective, there's a lot of layers to it. There's
Yeah.
like nurses, there's PAs, there's nurse practitioners, and then I
Mhm.
think there's the layer of like in certain states, right? Like I don't think nurse practitioners can have their own patient panel or they can't prescribe medicine without like a primary care doctor.
Right.
Can you share more about why nurse practitioner, why not PA, why not a nurse?
Yeah, so they all have their pros and cons and different things. So obviously a registered nurse or a nurse is the first step that you need to do to become a nurse practitioner. And what I like about being a nurse practitioner is I feel like you can be a little bit more independent. And at least for a nurse practitioner, we can bill for psychotherapy. From my understanding, I don't think physician assistants can.
Okay.
Um, and physician assistants follow more of like the medical model, like the physician route. So you don't have to go to nursing school. You can actually get like a biology degree, and then you go to PA school. And then with PAs, they teach you pretty much everything in your PA school. With nurse practitioners, you pick your specialty when you go to nurse practitioner school. So you can go to pediatric, adult geriatric, acute care, hospital setting, family practice, which is a clinic setting, or psychiatry.
Oh, wow. Okay, so it sounds like the nurse practitioner opens up a lot of different options and doors for you as well.
Yeah, a lot of specialties, yeah, that you can go into.
Yeah. Um, so how are you balancing school right now on top of work and everything? Because I know that for a lot of people, once you're in like a work state, it's hard to like go back to school and then to do that on top of your full-time gig.
Yeah, oh my gosh. I'm still figuring that out, but it's not it's not as bad as I was anticipating. But I did my nurse practitioner and this current nurse practitioner school both working full time, and
Oh,
so far it
wow.
has been doable because they are online, except for my clinical rotations. But I have a very supportive like group of like work coworkers and stuff that know that I'm in school. So I work 3 days a week at the clinic, and then 2 days a week I'm following a psychiatrist and a psych nurse practitioner, and it balances out fine. And then I just like read and do homework in the evenings, and I try to have the weekends to myself. Just started my second semester, so I have 2 more semesters after this, and just gotta grind.
Yeah, so you're pretty close then, right?
Yeah.
Nice. That's awesome. So, after you get your degree, do you continue seeing yourself working at the Within Center, or I guess what does like career progression look like for you after this?
Yeah, so I definitely still see myself being at the Within Center. I feel like we can definitely use these set of skills that I am gaining with my psych and P school there and really be able to help, especially the recovery community, wean off of medications and be able to manage their psychiatric medications better. Instead of having to like refer out all the time, I'll be able to be that provider for them there.
Got it. What type of people should consider like working as a nurse practitioner? Like, um, who's it for? Who's it not
Yeah.
for? What types of skills do you need for that kind of work?
If you are thinking about being almost a doctor but not wanting to go to med school, that's one.
And
But if you really care about helping others, you can really build your own practice as a nurse practitioner. You can build the way that you provide care. You can start your own clinic, your own business, or you can work for another clinic or a hospital. But if you're in that field where you feel like you're a healer, you want to help others, nurse practitioner could be a really good route. And as we discussed earlier, there's so many different specialties that you can do too. So like me, if you want to switch it up a little bit from open
mhm.
heart surgery to psychedelic medicine, you can do that.
Yeah, do you think shadowing is the best way to like understand that and like
Oh
gain
yeah.
insights into that? Or what was it for you that helped? I know that you jumped around and you kind of had a lot of
Mhm.
different experiences, but are there other things that you did to maybe help you understand that like, this is your calling and this is what really excites you?
Yeah, before I got into nursing school, I did do some volunteer hours at the hospitals around Austin, like St. David's and Seton. And so I really got to see how the providers like worked and how the patient care was. And I was like, okay, yeah, I really like this. I really dig this. And then as an RN, I was shadowing or kind of seeing what the PAs and the other nurse practitioners were doing and kind of seeing how that higher level of care that we can provide is like. And so I think shadowing is 100% helpful. Like I
Mm.
mentioned earlier, sometimes you have to go through some experiences. You have to like live through it to kind of see if you like it. And so if you know someone that is a nurse practitioner and they're going to let you shadow them, go for it because that's the one way that you can see if that's something that you like to do.
Yeah, and I think finding people to shadow, right? Sometimes that can be really intimidating. I don't know how you went about doing it, but I remember I was a tour guide at OU.
Mhm.
I don't know, back in like 2012 or something like that. But I was like giving a tour and told people I wanted to go to the health administration program, and or I think at that point I wanted to be a doctor. So I was like, I want to be a doctor one day.
Mhm.
And one of the guys on my tour was a spine surgeon, and he was
Wow.
like, here's my phone number. Like, let me know if I can ever help you or anything. And I was like, oh, like, can I shadow you sometime and just like see it? And he's like, yeah, yeah, like I'll get you in. And um, so like he got me all scrubbed up, and I got to watch a spine
Oh,
surgery
so cool.
happen. And so I remember it being so surprising because the reason why I asked you about like heart surgery earlier is because spine surgery was not what I was expecting. I thought it'd be like really intense, but you go in and there's this person like just flat on a bed thing, and then they have like a little cutout of like where they're gonna cut into, and they have it all drawn out. And it's around Christmas time, and I remember like we're there, and he asks the nurse for a scalpel, and he starts just cutting in, and there's Christmas music playing, and
Yeah.
as he's cutting in, he's like asking the nurse, "How's your son doing? Like, is he back from the holidays?" And I'm like, "This is not what I was expecting." And
Yeah.
um, I just remember like the shadowing experiencing being so valuable because what you perceive type of work being may not actually be what it is.
Yeah, exactly. Yeah, shadowing is really important. You can't just go by Grey's Anatomy and think that's how
Yeah.
it is, because it could be very different.
Yeah. Did you, I guess, how did you approach people about shadowing? So for those that are maybe like nervous about that or don't know how to like reach out to people, how did you go about doing it?
Yeah, so the easiest way is to see who's already in your network. If you don't know someone directly that is in that field, reach out to your friends and see if they know someone that's in that field. It's way easier to get in when you have like a connection. And that's why
Mm,
it's really important to always keep your network open. LinkedIn, social media, all of that. If you absolutely don't have anyone, start looking into the specialties that you think you might be interested in. Go to their websites, read up on those providers, read up on the services. And I feel like it's more personal to actually just print out your resume, put on a nice outfit on, and go to the office
oh,
and
like
hand them the
physically show
resume.
up?
Yeah, that's how I got some of my preceptors for my nurse practitioner school. I just like had my resume and I took it to the front desk and I was like, I would love to, follow Dr. So and so.
Really?
Yeah, and I got some of my rotations that way.
What? I feel like, yeah, like very rarely do people think of like showing up in person because I think it's so
Yeah.
easy to be like, I'll email them or like I'll send them a note. And then it can be so disheartening when you don't get a response. But I think there's something to be said about showing up to the place, presenting yourself, and like just the intentionality of being there. So I love that that's how you did it. I had no idea that that's how you got some of it.
Oh yeah, they get too many emails. They're probably not going to see if you email it, but yeah, this really personal to kind of just show up and they can see your face, and the front desk person can really speak for you. Like, hey, this guy came and he's like really cool. Yeah,
Uh-huh.
so definitely recommend that.
That's amazing. So you met some of these people and then they just started letting you follow them around, or did you just spend like
Yeah.
a month or two with them, or how did that work?
Yeah, so they either emailed me back, and then I went there to meet them, and then I started following them. Put my white lab coat on and started following them and kind of seeing how they did patient treatment based on the specialties they were in.
Mm. So if you could go back to like an older version of Brittany,
Mhm.
are there things that advice that you'd give her or things that you would do differently?
Yeah, I mean, I don't know if I would change anything because I feel like I'm where I'm at now because of how everything got laid out. But I would tell her to keep your head up and be patient with the path that you're on. Everything is happening exactly that the way it should, and try not to control things that are out of your control. Get out of your own way.
Get out of your own way. Yeah, I love that. I think it's very like stoic, right? There's I don't know how familiar you are with stoicism, but I love reading about stoicism, and they have these like principles on the triage of control. And it's essentially this idea of like you can evaluate a situation and bucket it into potentially three different buckets, right? So something that's completely out of your control, then there are things that are partially in your control, and then there are things that you can absolutely control. And so the Stoic principles are out, they always talk about how for those things that you can't control, right? Like you can't control it, right? So there's nothing that you can do. So why worry about it? Like there's nothing there's you can't change that situation, but there are some things that you can control, right? So that's where you should spend a lot of your energy and your focus on rather than the areas that, you have little to no control over.
Yeah, exactly.
Yeah.
And if you can't change your external world, you can most definitely change your internal world.
Yeah.
So really focus on your internal world and how you're feeling about that situation, and kind of look into releasing the stories and the attachments that you may have to that situation that you can't control.
Yeah. Are there tools that you use or like frameworks that have helped you think about, I guess, evaluating your internal world and thinking through that?
hmm Meditation's really helpful. If you feel like you're in your head a lot, if you feel like you ruminate a lot or you have a lot of anxiety around something, what is really helpful is just word vomiting on a journal, or even kind of, you might look crazy, but I know a lot of you guys do it anyways, but like talking out loud to yourself. It really does help you process through things and really kind of helps you make sense of a lot of stuff. So get those words out of your head and onto paper or out to a therapist maybe.
Hmm.
That will really help you organize your internal world and help you kind of find your peace and your center.
Yeah. So you've talked about meditation, I think a couple of times now.
Yeah.
Do you meditate a a lot?
I try to keep up with the meditative practice. Yeah.
Yeah. Do you use an app or like how do you approach meditation?
I started off using an app like Othership.
Othership? I haven't heard of that one.
Yeah, it's pretty. They have like guided meditations, some really short ones and really long ones. But I have been exposed to different meditations, and I kind of do my own meditation. But my favorite one, if you're new to meditation, is to kind of just close your eyes and do a body scan. So
Mm,
kind of just imagine like a little scanner scanning your body from the top of your head all the way down to your toes, and kind of just have that time to really see how feel into how your body feels and where you're scanning. And that really kind of helps bring you into the moment and bring some awareness to your body. And that's super helpful.
yeah. I used to use, I think I've tried a couple different ones like Headspace and
Headspace is a
Calm.
good one too.
I really like, oh, what's it called? It's one by Sam Harris. Waking Up app.
Oh,
Have you heard
yes.
that one?
Yes, those three, yeah, those are good.
Yeah, but the body scan one's always really good. And I found I need to get back onto meditation. But one thing, like when I was meditating more consistently, one thing that I think it really helped me with was like just being more present. And I think this
Mhm.
like it's a skill to be more present. And I think I think it's Headspace that's really big on like body scans.
Yeah.
But they would talk about like, now envision, feel this part and like this part of your body. And like it really brings you into like the present moment. And I think it's really hard for adults to be more present because you're worried about the past and things that have happened. And then you're also worried about the future and things that you have upcoming. And so the being able to like center and practice that, I think it really, like to me, it felt like I was developing this muscle of like being fully engaged in the moment rather than, my mind is bouncing all around into like different time frames, if that makes any sense.
Yeah, and that's exactly what it is. You're like working out this muscle and strengthening that muscle until it's like your normal everyday weekly practice.
Yeah. Yeah, that's awesome. So I guess like I know we started off with ketamine treatment and we've talked about that whole journey and process. I guess if someone's interested in this type of treatment and learning more about it, what's the best way for them to do so?
Mhm.
Like how can they reach out to you and how
Yeah.
could they?
Yeah, so we do have an Instagram. It's at within.center and a website. We do have a FAQs page that goes over a lot of the basics about ketamine and psychedelic therapy and integration. There's also links to different articles. If you're more of like, I want to see the data, I want to see
Mm,
the evidence, that's on our page as well. And then our contact information is there too. I mean, you can also contact me directly if you have any questions or anything like that. Yeah.
that's awesome. Is there anything else that you'd like to share that maybe we didn't like hit on yet?
Um, I think we hit on a lot. Yeah.
We covered a lot of ground.
Yeah, I think we covered a lot of ground. I mean, the psychedelic talk, I mean, I can go on forever, but
Yeah.
but yeah, no, it's just a great way to really find root causes for things and to really find yourself. And
hmm
when you find yourself, everything in life becomes easier.
Yeah, that makes a lot of sense to me. Well, thanks for joining me. Today is Lunar New Year, and
Yeah.
so after this, Brittany and a couple of our friends and others, we're all gonna head to a local Vietnamese church and celebrate the new
Mhm.
year. And just wishing everyone that's watching a happy New Year. And thank you so much again, Brittany, for coming and
Thank you
sharing
for
and
having
just
me.
sharing more about psychedelic treatment. I think it's really new, and I don't think a lot of people have heard about it. Like this was probably one of the first times I really started to dig in to try to understand what other treatment paths are available. And
Yeah.
excited for you to finish your degree and then maybe have you come on as a part two as you learn more about
Oh,
different types of treatment.
I would love to. We can dive deeper into that. Yeah,
Yeah, that's
for sure.
awesome. All right.
Thank
Well,
you.
thank you.